Hi, this is Dr. David W. Kim. Today's Rhinoplasty video blog is about digital morphing. This is a computer-generated exercise which can allow a surgeon such as myself to better communicate with the patient in terms of what expectations should be about rhinoplasty. In the old days, we didn't have this technology, and we would try to explain to patients what could be done, what couldn't be done, what should be done, and what shouldn't be done. It was very difficult to paint a picture in the mind of an individual just using words. Sometimes we'd use photographs, sometimes we'd have them in front of a mirror and try to explain with words what was possible. Not until the advent of digital imaging could we really portray an accurate picture on the face of a patient of what could be possible. So for the purposes of this demonstration, I'm going to pick on a couple of celebrities who you may recognize. Now, this obviously is Barbra Streisand. She's known for her nose. To my knowledge, she's never had any type of a rhinoplasty, and I think that her nose makes her look very natural, very beautiful. But theoretically, in an alternate universe, if Barbara wanted to come and see me for some change in rhinoplasty, here are some of the things that we might be able to do for her. First of all, we could sort of change the rotation of her nose, make it a little bit shorter, a little more feminine, a little more elevated. And then potentially, we can do some changes to bring down the bump on her bridge. And by making these changes right in front of the patient, the individual can very clearly and distinctly see what options would be without having to imagine just from the use of the words that I provide for them. Now, it's difficult to get it exactly right with an imaging program, and it's difficult to show a perfect representation of what will happen given the fact that a two-dimensional image can't accurately portray a three-dimensional result. But this is a very nice exercise to start a conversation. So this is what we can do. We show them a comparison, sort of like this, a before, after, to bring to light the possibilities of surgery. This exercise is very helpful on the profile view. It's also helpful on the front view. This handsome gentleman, Owen Wilson, he's definitely known for his nose as well as his dry humor and his comic sensibilities. He's not someone I think would ever want a rhinoplasty because the unusual and unique shape of his nose sort of accents his quirky personality in some of the roles he plays. But again, in an alternate universe, let's say Mr. Wilson came to see me for rhinoplasty, wasn't sure what was possible, and I wanted to demonstrate, Mr. Wilson, let's say that we just want to align the profile of your nose. I can show him through the magic of this digital technology what that change would look like. So before, after, before, after, before, after. And we can then further, if he wanted to address changes down at the tip of his nose, to shorten his nose, to make the base a little flatter, to reduce the shadowing, which creates a little cleft between his lower cartilages. Take another step. This really dovetails nicely with my approach to rhinoplasty because I don't believe that rhinoplasty ought to be an all or nothing thing. I don't believe rhinoplasty should be a surgery where an outcome is dictated completely by me. I think that the patient really needs to have some say in the matter, and the patient's preferences based on their family traits or ethnicity or simply their aesthetic taste really should help dictate what the outcome ought to be. So this exercise really helps this consultation process be cooperative rather than a one-sided process where the surgeon dictates what ought to be done. So the final touches here on the tip and showing before. There he is now with an irregular bridge and the tip a little bit low. After, before, after, before, after. So whether or not that's really what Mr. Wilson would want is left in the world of a theoretical alternative universe. However, this exercise in general is something that can be very helpful, whether it's a celebrity or ordinary people seeking rhinoplasty. A happy patient depends on a good outcome, but it also depends on realistic expectations. And this tool very much helps in creating those expectations. Thank you.